Tässä on temptik. Ja aksuunum ka mam skuutame tavu teemaga niiska puuni kuuta. Ja kohe no tead musta tatakuptaan sisumagisi ke tuutama. Ja on nyäläsi monota. This morning I got a phone call from Dr. Suran, from Finip, and he informed me just before lunch that there was a COVID case in Saddle Lake, and then he would call us back with details and more information. And so Derek and I talked to him this morning. Derek Cole, our emergency management director, we talked to him early this morning. And he said that there was one case here. It was identified in September the 3rd, and they got the report last night. And it of course came as a shock to us because we did a lot of work in terms of trying to prevent COVID from entering our community. And our early success was based on a number of things. One, we took it to heart that this was an illness that could have very devastating effects in our community. So we did recommend certain things. One was social isolation or physical isolation. Stay home if you're not doing anything as much as possible. The other one was wear masks, and also sanitize, and self-isolate if you're feeling sick. Avoid coughing, coughing and cough in your sleep, and do not travel as much as possible. And what we've learned since then was that it did have an effect in the sense that Saddle Lake was COVID-free for 6 months. A total of 6 months we were COVID-free. And we've had other communities where they didn't take this thing seriously. Let me give you a story that tells you how one thing can be so important. In La Creek is a community of about 2,400 people. There was 300 cases there. But there was also the community where 2 reserves went to shopping. One was Tall Creek. Tall Creek handed out masks like this to every member that went shopping there. And nobody got COVID. Another reserve close by didn't do that. And there's now 20 cases there. That's what doing simple things that you may be uncomfortable with can make a big difference. And that's what we're recommending again, is going back to the basics. Practice social physical distancing. The other one is self-isolate if you're feeling sick, you have a cold, but more importantly, come into the health center and get a test. We have outstanding staff at the health center. Staff that is committed to the health of our nation. And they do wonderful work in terms of testing and providing the services that we need. So if you have any symptoms, and the symptoms are coughs, fever, shortness of breath, running nose, and sore throat. If you have any of those, do not hesitate and get tested. And the other thing that we want to tell people too is that if you're afraid of testing positive, do not be. Because if you test positive, your chance of recovery goes sky high. Okay? But the other thing is that you don't spread it. You don't spread it to people you care about and love, And it's a sign of great respect when you do that in terms of protecting your health. But also, if you do get tested positive, do not be afraid, because Saddle Lake will support you in terms of your recovery. I know your access to the outside world will be limited because you'll be in effect quarantined, but we will provide the support, to give you the best chance of a recovery. Okay? The other thing that health center has done is they already have started contact tracing with this individual. We don't know who he or she is, but they've already started the contact tracing. And that is important because we need to know who are all those people that came in contact with him so that we can get them tested as quickly as possible. And if they have this virus, that we can help them recover their health as quickly as possible. So one of the things that we're going back here on the reserve is we're going back to the basics. We're encouraging people to stay home as much as possible. Do not travel as much as possible. The other one is that if you have symptoms, get tested and test it. Do not be afraid to get tested. The other one is that physical distancing or social distancing. The other one is avoid touching your space, and if you have to sneeze, sneeze into your elbow, and wash your hands frequently. Those are the basic things, and we can prevent this thing from spreading, and we can prevent this thing from getting worse, you know? And we need your help. We need your help to do that. And we will provide as much support as we can to make that happen. And you have to remember our early success was doing those basics, you know, encouraging people to do the basics. But now that it's arrived, we still have to go back to those basics. And again, we want to thank you for your help, and we want to wish you the best of luck and, you know, best health. Again, thanks.